It's everyone's nightmare. The patient wakes up from anesthesia to find out that he or she had the wrong surgery. Wrong site surgery means surgical procedures performed on the wrong patient, the wrong body part, the wrong side of the body, or the wrong level of a correctly identified anatomical site. I'm Pat Iyer. I have been a legal nurse consultant since 1987, and I mentor nurses who want to become legal nurse consultants or expand their businesses. What can the operating room staff do to assure that the correct surgical site, patient, and procedure is selected? Here are important safety steps. Mark the surgical site, involving the patient in the marking process. Create and use a verification checklist, including appropriate documents, for example, medical records, x-rays, and imaging studies. Obtain oral verification of the patient, surgical site, and procedure in the operating room by each member of the surgical team. Monitor compliance with these procedures. Surgical teams, including the nursing staff, are required to take a time out in the operating room to verify the correct patient, procedure, and site, including active, not passive communication. Operating room nurses will say that sometimes in the rush to get surgery started, that critical steps are skipped. What are the nurse's responsibilities related to incorrect surgery? First, review the risk factors and the root causes defined above to see how they apply. Be aware of the high-risk situations that heighten awareness of the risks. Periodically participate in auditing the correct site, those verification forms and processes to ensure that they are being followed and they're appropriately completed. Act as a preceptor for new personnel and inform them of the policies and procedures for site verification. Participate in correct site and patient identification as defined to include the pre-procedure verification process, marking the procedural site, performance of a timeout before starting the procedure, and assuring compliance with site verification procedures in non-traditional surgical areas, including radiology suites, ambulatory care areas, and the patient's bedside. Follow site verification policies which meet the unique problems which have been identified through analysis of the processes, systems, and data. When surgery begins at change of shift, confirm that the previous shift has performed the site verification. Implement safety standard protocols for site verification. Do not allow surgeons, anesthesiologists, or others to rush the site verification process. Follow the facility policy for patient disclosure for unanticipated outcomes. From a legal perspective, it's difficult to defend these cases. The defense attorney may argue that the patient was not harmed by the wrong surgery and try to minimize the damages. It's easy for the plaintiff attorney to argue that it should never have happened. Get more great tips about ambulatory care by investing in a copy of my book, Safeguard Your Ambulatory Care Practice. See the link below, which is on patiyer.com, and subscribe to my YouTube channel and leave a comment. If you're watching this on YouTube, head over to patiyer.com for your free ebooks and e-zines and to order the book.